and what it doesn't cover can cost you some money. That's why you should consider an AARP Medicare Supplement Insurance Plan, insured by United Healthcare Insurance Company. It can help cover some of what Medicare doesn't, so you could save up to thousands of dollars in out-of-pocket expenses. Call now for this free information kit and Medicare guide. If you're turning 65 or you're already on Medicare, you should know about this card. It's the only one of its kind that carries the AARP name. See if it's right for you. You choose your doctor. You choose your hospital. There are no networks and no referrals needed. Help protect yourself from some of what Medicare doesn't cover. Save up to thousands of dollars on potential out-of-pocket expenses with an AARP Medicare Supplement Insurance Plan, insured by United Healthcare Insurance Company. Call now for your free information kit and Medicare guide, and find out how you can start saving.
Well, 60,000 and counting. That is how many seniors have dropped their AARP membership since July 1st. That is 10,000 a week. They're lashing out over the group's position in this healthcare debate. My next guest, one of them, Lonze, joining me right now. We did call the AARP for a statement. They have not returned our call as yet. Marianne, leaving, why?
Well, I have been a member of AARP for the past 9 years, but I find that their increasing liberal leanings is just not representing my interests, and apparently not the interests of some 60,000 members who have canceled their membership since the 1st of July.
What specific liberal leanings?
Well, I think what's happening is I feel that we're getting something of a sleight of hand. For example, a few days ago when the president said that AARP is on board with the health care reform, and he said it was good for the seniors, and then AARP came on afterwards and they said, well, no, that statement is inaccurate. And then a couple of days later, I saw a commercial that encouraged AARP members to contact their congressman and give their support to the bill.
So you think they were getting mixed messages? I'm sorry, you were thinking, Marianne, they were giving mixed messages. They were saying they were against it, you were seeing these ads in favor of it, and so you don't think the president was wrong when he assumed that the AARP was behind it, right?
Well, I think what was happening is the AARP was telling the membership one thing and doing another thing, and really not keeping us abreast of what they were actually doing.
Now the AARP, Marianne, I got you, I pinched for time, so I apologize for jumping on you, but the AARP has maybe been looking at all of these healthcare town hall meetings and rallies and assuming, you know, a lot of the folks who've been screaming and ranting and raving, they're their bread and butter, the AARP members themselves. And they've just decided to pull back. Is it too late?
Well, I think what needs to happen is we need to get away from the emotionalism and actually look at some of the different provisions of the bill, and to see that there are a lot of, number one, unanswered questions and other things that are not necessarily going to be very helpful for seniors.
So you're not going back to AARP?
I'm not going back to AARP, that's correct.
So if it said, look, we're now against this reform package, too little too late?
Well, I think it is too little too late, and they have over 40 million members, and apparently they have not really been paying a lot of attention to the small slice of their population who have cut up their cards.
Gotcha.
And so what I did, in addition to cutting up my card, it's a symbolic gesture. But I also decided to take it one step further and write an artical about it.
Indeed,
let my voice be heard.
Indeed, you did. Marianne Lonze, thank you very much.
Thank you so much.
Well, you think you've seen anger